My name is Lindsay Bartlett. I'm a former student of Cisco College, and I graduated from the respiratory care program here, and I'm a registered respiratory therapist. I chose respiratory therapy because after doing some research, it looked like a really fun profession, very fast-paced and changing and growing all the time. Since entering the field, my job has changed drastically. In the beginning, it was, I would say, pretty normal. You get patients in, depending on the setting that you work in, if you're ICU or floor, you get a similar cases a lot. Well, 2020 hit and we got COVID, so that changed pretty much everything. And even just as small as PPE is different now. I mean, you have to mask up anywhere you go. And even what's important now to patient care, I guess. It was a lot of times, a lot of breathing treatments were needed for not really needed, but they were ordered a lot. It was a lot of tedious tasks, and once COVID hit, it kind of knocked the tedious things out, and we only did what's important. It also kind of amplified our field quite a bit, and we definitely are now, respiratory is a necessity now. Our job has basically blown up into something huge, and every hospital needs us now. If you're considering respiratory therapy, I would definitely try to shadow one before you apply to the program, just to kind of see the general job. You're not going to see every bit of it, but it would give you an idea of what your day may look like. You can ask questions about how your schedule's going to look. Most of the time, respiratory therapists kind of work the same as a nursing schedule, 3 to 4 days a week, just depending. But those are things you don't know unless you've worked in the medical field. So my biggest recommendation would be to shadow first. Definitely just Google what a respiratory therapist does. You're probably not going to understand it unless you come from a medical background, but come talk to the instructors, come ask someone about it. Talk to anybody. They'll tell you what a respiratory therapist does, but definitely don't walk into this blind. One thing I most look forward to in my career is becoming like a charge or a lead respiratory therapist for the hospital setting or management. It just makes it's furthering the career.